Thank you, Honourable Speaker, and I thank the Honourable Member for the question. Honourable Speaker, the lymphatic filariasis, or sometimes called elephantiasis, is caused by nematode, and globally there's about more than 860 million people in 47 countries worldwide that are threatened by this lymphatic filariasis. And they require medicines to prevent it, or preventive chemotherapy or chemoprevention. Honourable Speaker, it's labeled as a neglected tropical disease, and more than 8 billion cumulative treatments have been delivered to stop the spread of the infection since 2000. In Fiji, the lymphatic filariasis program has been around for 21 years and has been based on the collaboration that we have with WHO to achieve a global target of elimination, which was set at elimination being less than 1% prevalence in the population by 2020. However, WHO has reset this target to 2030, and there are many countries that haven't met it. In Fiji, we've noted there's a particular province only which has more than 1% prevalence. Fiji is a member of the 22 Pacific Island countries under the Pacific Elimination Lymphatic Filariasis umbrella, continues on our journey to combat filariasis and head towards meeting the elimination goal. As we all know, with this problem, it can cause disability and a disabling disfiguration also. Mass drug administration is one of the program's main strategic pillars, and in interruption of lymphatic filariasis transmission from 2002 to 2007. We have actively implemented mass drug administration rounds, followed by surveys to check our prevalence. And the aim is to decrease our national prevalence rate, and this was widely reflected in the drop of prevalence rate from 16% in 2002 to 9% by 2007. In 2010, a divisional specific strategy was implemented targeting specific issues within the 4 divisions. The Central Division underwent 8 rounds of multi-drug administration, and based on their second transmission assessment survey in the year 2017, the prevalence rate remains in the Central Division less than 1%, with only a hotspot in Serua. The Central Division is scheduled for a 3rd transmission assessment survey in the coming months. This will determine whether we need to do MDA in the Central Division next year or not. The Western Division has passed 3 of the transmission assessment surveys and has maintained at less than 1% prevalence, except for Malolo. The Eastern Division is yet to start with its first transmission assessment survey due to the high prevalence rate. The division was scheduled for 2 rounds of MDA between 2020 and 2021. This was due to 2019 Central Survey's results of about 7% prevalence. First round was implemented in 2020, second in 2021. However, the COVID-19 restrictions put in place in the second wave of the outbreak has pushed the second round to August 2022. The Northern Division has implemented 3 rounds of the transmission assessment survey. The first 2 rounds of the survey maintained a threshold of below 1%, which was in 2013 and 15, whereas the 3rd round in 2018 saw a prevalence rate of more than 1% in the Northern Division. This indicates that the Northern Division has not achieved its objective of reducing the levels of microfilaria in the endemic population to an extent where transmission is likely to reoccur in the Northern Division. Therefore, Honourable Speaker, 2 rounds of MDA, or multi-drug administration for lymphatic filariasis, were required in the Northern Division in 2019-2020. The first round, which was done in collaboration with the scabies project, also to eliminate scabies, called the Big Shift project, and was research going on with it, was implemented in July to August 2019 with a good multi-drug administration coverage of more than 80% in Bulolebo. The second round of MDA was scheduled to take place in July-August of 2020, but due to the pandemic has been postponed, and we're hoping to do it within the next few weeks. Honourable Speaker, thank you.